I think nurses will have to understand, as well as medics, that patients can be much more informed when they come to the hospital. I say can be, because we cannot assume that they all will be. But I think we have to be prepared that we will have contact with patients who have been well informed, who have been looking for information, so that we have to be able to adapt ourselves to the different kind of patients that we will meet. We as nurses, we see patients all the time, but most of us will see patients on a very short time. For example, ambulant care, or patients who come just for 2 days in a hospital. So I think the relationship nurse-patient that before was a relationship that could be created smoothly and longer is no longer the case. I think patients will see a lot of different faces, different names, very short time. And I think we as nurses, we see a lot of patients all the time without knowing them too much. And that's a pity, I think. So I'm a big believer in what I would call nurses who are managing a group of patients, so that the patients have one case manager who is a nurse who can deal with all kind of aspects that are important for the patient. If somebody is educated, then I think he can take what I would call informed decision, because you cannot ask somebody to take a decision if you have not all the information that you need to take a decision. So an educated person is able to look for information, is able to analyze information and deal with it appropriately, because information, as we said in the speech, can be biased, can be subjective. So if you are well educated, you are able to judge information in the right way. And I think if you have been educated, I think you will feel more responsible, and you will collaborate more, and you will be more a partner in the whole process. I think that's for me the most important thing, the partnership issue. The Cancer Tales project is, I was involved as a reviewer in the way that when you read the booklet Cancer Tales, it's quite, it's a patient story, very short fragments of, for example, how they were diagnosed with cancer or how family reacted. So it's quite, apparently in the UK, a well-known play, but I've never seen it. And based on the stories of these patients, we created questions, case studies, and we hope that this can serve as a good instrument to educate healthcare professionals on how good and effective communication should be done. But I would say go to the website, surf, and look at it.